I had a lot of last minute cancellations, so
Okay.
yeah, more cookies for us.
Great, great. I'd like to call the Community Advisory Council meeting to order at, my phone says it's 3:05. So, welcome everyone. What I'd like to do is have everyone introduce themselves so we all know who we are. And we'll start off with you, John.
John Adams, Eastern Oregon Healthy Living Alliance.
I'm Charlie Twait, I'm the HUSPO CEO.
I'm Susan Campbell, I'm the Lake Health Clinic Manager.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
Brooke Kelleher with Food Corps.
I'm Diane Clay, I'm consumer advocate.
Christy Alberts.
Well, anyway, you know, one of them.
And volunteer extraordinaire. I'm Christy Albertson.
Yeah.
I'm the grant writer and coordinator for the health district.
I'm Francie Winters. I'm the prevention coordinator for covering the county under Lake Health District.
Arvinder Singh, I'm the Community Health Improvement Partnership Coordinator for Lake County Lake Health District.
And I'm Wendy Brown, and I'm the Community Partnership Coordinator for Klamath and Lake DHS Self-Sufficiency.
Excellent, welcome. And who do we have on the phone?
I'm Kathy Fife, Outreach and Involvement Advisor from Alpine Community Health Center in Christmas Valley.
Hi, Kathy.
Shelley McKittrick, Outreach Manager for Alpine Community Health Center in Christmas Valley.
Hi, Shelley.
This is Maria Waters, Regional Outreach Coordinator for OHP. It is almost impossible to hear everybody on the phone. That's just a heads up.
We'll speak louder. Thank you, welcome.
Fantastic, thanks.
Anybody else?
I think that's it.
All right, well,
How are you?
if you, the next order of business to look at our minutes, has everyone seen?
I sent out an email, so I still don't have the minutes.
Oh, you don't have the minutes?
Yeah, so I've informed the council and
All right, well, we'll get minutes for the next meeting then.
yeah.
Yeah, okay.
Is that going to work for you, or is that?
Yeah, no, I think that will.
All right, so then the next item of business is, John, can you give us a EOLA presentation?
I've been in a recliner for about 3 weeks, so I'm gonna see if I can stand up here for a little bit.
Sorry, John.
Be healthy, be happy, Eastern Oregon. I'm John Adams, Director with Eastern Oregon Healthy Living Alliance. And could you, you want to flip to the, is there, did you take up?
Yeah, there is one. Let me.
Just give me the mouse.
We can give you the mouse if you want.
Either one?
Yeah, let me give you the mouse.
So the Eastern Oregon Healthy Living Alliance, we're a nonprofit that was formed by the EOCCO's Regional Community Advisory Council to help support regional health priorities, including oral health, mental health, chronic disease, and early childhood health. So there's a whole process that happens on the regional level to identify these issues and other issues that become a part of the EOCCO's Regional Community Health Improvement Plan. So what does a healthy, happy Eastern Oregon look like? So I'd like to share our vision of a healthy, happy Eastern Oregon. But first, I think it's helpful if we take a look at why these regional health issues were prioritized. And also I'd like to share a little bit about the work we've done to address these issues. So my understanding is the new Oregon Smile survey is set to come out any day now. The last Oregon Smile survey, however, you can see that, so looking at oral health, through the Oregon Smile Survey. You can see that in a large geographic area of Southeast Oregon, we have the highest cavity rates within the state, 21% higher than the state average, so significantly higher than the state average. I think all of you guys are familiar with these statistics. So our strategy is similar to what you guys are doing. It's a school-based oral health program. Ours is called Healthy Happy Smiles. We're partnering with Advantage Dental, who provides the free dental services. We're working with around 4,670 kids in 29 schools in Grant, Harney, Baker, and Mount Airy counties. We kicked off our program. The first year of the program was the 2016-2017 school year. So last school year was the second year of our program. And we made drastic improvement from year 1 to year 2. So 22% increase in parent consent forms, 9% increase in the screenings, 14% increase in fluoride application, 1% increase in the sealants, and 16% increase in oral hygiene education. So this school year, we're implementing the program in this school year, the 2018-2019 school year, and we're hoping to continue this trend of improving our numbers so that ultimately we can serve and help support more kids. So through the household surveys that we conducted in Lake County and several other Eastern Oregon counties as part of that first community health needs assessment our CACs did, we learned how a lot of folks were reporting feelings of feeling down, feeling depressed, reporting feelings of hopelessness, anxiety, and despair, but they weren't seeking any help. Generally, we're aware that there's a growing mental health problem within our communities, across the state, across the country, and it's occurring at younger ages. Last year, through the Oregon Teen Health Survey, we learned how the teens identified more mental health resources and support as the greatest need in the schools. So our strategy is to reduce barriers to care and to increase connections to care for folks who experience mental health illness. And we can do that by providing mental health first aid and youth mental health first aid trainings to teachers, law enforcement, other public and social service employees who work closely with the community. Mental health first aid, as you may know, it trains folks how to identify, understand, and respond to individuals who may be experiencing mental health illness and help to connect them to the appropriate care. So to that extent, since 2016, we've provided or helped to support 43 mental health first aid or youth mental health first aid trainings, including 5 in Lake County. So we did one last fall with North Lake School District, 2 public safety here in Lakeview, 1 older adult training again here in Lakeview, and then we have 1 scheduled at the end of this month with in Christmas Valley. So so far we've trained 659 folks, certified most of them. 84% indicated an increased confidence in their ability to refer and connect individuals to care. So this year we wanted to do something different, and we wanted to see, do these trainings work? Does it actually lead to connections to care? And so we started sending out post-training surveys to the trainees at the 6-month mark and the 11-month mark post-training. So of the surveys that we've sent out so far, and of the people who have responded, they've reported 42 referrals were made, of which there were 18 connections to care. So that tells us, at least at some level, that it's working and that it's leading to connections to care. What's interesting is that I think the majority of these were from public safety and law enforcement folks. So these guys are really taking this seriously and applying this and supporting folks in our communities.
Can we ask questions?
Yep.
I think that's a great idea, John, but I'm just curious, how many people wrote back and said, I made no referral or no connection? How many people responded to it that said, I did not do it? Because I think that becomes part of the reason why the return rate is small.
Yeah.
So how many came back with, that didn't say they referred or anything?
Right, yeah. I mean, we have that number. I don't have it readily available.
But people were sending it back and saying, I didn't do anything.
Yes.
Okay.
Yeah.
Doesn't mean it won't.
No, I get it, but I mean, I think,
I'd be interested to see that over time.
Yeah.
Because it's one thing to get people trained, but if they don't have, of course, it's like CPR.
right.
I hope you never have to use it.
Yeah.
So you get a lot of people trained and they say, well, how was that great? Well, I feel more comfortable, but I've never had to do with it.
Yeah.
Is that a good thing or a bad thing? Hopefully, it's a really good thing you haven't ever had to use it.
Yeah.
John, do you know of those referrals and connections? Are they pretty well spread out across all of the trainings and all the places where you held the trainings? Or is it a handful or a couple of different places or different agencies that are making the referrals? You said law enforcement, but
Yeah.
is it one particular sheriff's department?
Yeah, I don't, I mean, we could look that up, but
Just curious.
I know that at least, we were able to, pull out that there's a large percentage that are law enforcement. I don't know about in terms of kind of geographically and other organizations, but the law enforcement one just definitely kind of stuck out.
Yeah.
So under chronic disease, we're focused on in a couple areas, including colon cancer, and we're looking at how significantly fewer adult Medicaid members report being up to date on their annual screening compared with the general adult population. We know that the EOCCO hasn't met this metric in the past couple years. The result of this lack of screening is higher colon cancer mortality rates in Eastern Oregon compared to Oregon statewide.
John, I think we did need it last
We had
year.
it last year.
Really?
Yeah. We just made it.
Barely, we had, it was like our last four slid us in under the wire.
Well, for Lake or all of yours?
For Lake.
I think I'll have to check, but I thought we did.
Okay.
If not, it was real close.
I think it was really close.
I know, but the year before it was 8.
Yeah.
It was just 8 that
Yeah.
we missed for the whole region. Sorry.
So in 2016, we conducted focus groups in 5 Eastern Oregon counties, including Lake County, to identify best practices to outreach to the adults aged 50 to 75 and to increase their participation in the annual screening. And then earlier this year, we initiated a grant-funded project by the OHSU Night Cancer Institute to implement the findings from that focus group project. And so we're doing that in 3 counties, Morrow, Sherman, and Gillum counties. The activities are focused primarily around small and mass media, group education, and clinic-sponsored direct mail. So I think similar to what you guys also have been doing here.
Yeah.
So obesity is the other area we're focusing around under chronic disease. Looking at EOCCO, we have the second highest obesity rate amongst the 15 CCOs. And we also know that there are several Eastern Oregon counties that are reporting annual increases in that obesity rate. If you look at the graphic, you can see just over time kind of the trend in America. And if you look at our current obesity rate, you can see that we're still part of this growing trend, literally and figuratively. This has impacts obviously on the health of the individual, community health, and also has impacts on the local health system. So our strategies, healthy eating and active living. For healthy eating, we're planning on organizing focus groups targeted towards Latino moms, and we want to increase fruit and vegetable consumption of Latino moms through Food Hero programming. And so we're partnering with OSU Extension. We'll be working with them, and they'll be implementing the findings from this project in their Food Hero programs in these 3 counties of Umatilla, Morrow, and Mount Airy counties where we have high Latino populations. For active living, we want to initiate community hiking groups targeted towards, but not limited to, low-income moms with kids up to 48 months. Looking at providing this in up to 6 Eastern Oregon counties, and including Lake County. And I believe Alana came out here and talked with you guys about wanting to do this, and just wanted to make sure we're not conflicting with any plans that you guys had and that you guys were supportive of us doing this. So we're currently in the fundraising mode for this, and we should find out later this month from two funders about funding for this project. So we'd be looking at getting this started next kind of late spring when the weather's a little friendlier.
Just to put a bug in your ear now, this would be a good thing to promote on Outback Strong once you guys have materials and flyers and whatnot. We'll help you push that way.
Awesome. Thanks so much. And then for early childhood health, we're looking at the high maternal depression rates in Eastern Oregon, 28.8%. And just to give you guys a sense of the significance of this number, the national maternal depression rate average is it ranges from 10 to 25%. The statewide average is 20%. So we're above that national average range, and we're significantly above the statewide average. We're also aware that maternal depression has impacts on on healthy childhood development. So in 2016, we formed a collaborative dedicated to supporting early childhood health by addressing maternal depression through the Integrated Nurse Home Visiting Program. And so this is it's a new service model that integrates in-home mental health counseling through public health home visiting programs. We're piloting this in 4 counties, including Umatilla, Morrow, Grant, and Mount Airy counties. We've developed a learning collaborative also to support implementing this new service model over the first year of the program. We've raised $195,000 to provide the project. We officially launched on August 21st with the first learning collaborative, and so the Q2 learning collaborative meeting will be later this month. So part of our purpose for forming Eastern Oregon Healthy Living Alliance was to be able to provide programming, resources, and funding not only to the OHP population, because we know that's really what the EOCCO is focused on, but to the broader community as well. And so we go out and we partner with other outside funding organizations. So we look outside of the EOCCO, we look at other funding organizations and partner with them to bring more resources within Eastern Oregon to help us to do this work. And so to that extent, since we've started, we've raised this is actually, it should be 611,000. So that's non-EOCCO, non-operational funding to go towards community health improvement projects in Eastern Oregon. So, what's our vision for a healthy, happy Eastern Oregon? Our vision for a healthy, happy Eastern Oregon is where school-age children have adequate access to oral health programs so they can learn, play, and thrive, where mental health first aid is as common as CPR, where there's a culture of health where opportunities for health begin long before one needs health care, where families have the knowledge and available resources to change their behaviors and prevent chronic disease, and where moms have maternal depression resources and support, and babies and toddlers have a strong, healthy start. So every year, we've been able to raise some funding from a lot of funders, but that's really kind of limited to grant programs. So it's important for us to also be raising money to help support our general operations and to support these programs as well. And so every year, as part of our annual giving campaign, we ask folks to help contribute to our organization. So I believe within your guys' packet is our annual fundraising letter. It really just kind of articulates, this is really, the fundraising letter and this presentation really kind of go together. So it just talks about a healthy, happy Eastern Oregon and the work that we've done to help create that. And we hope that that folks are able to help us create a healthy, happy Eastern Oregon. So hope you guys will take a look at this, and you guys can make a donation through our website at eola.org/donate, and we have our address here as well. And then we'd also like to ask you just to use the power of your social media networks to help us get the word out. So I'm hoping that I can send our online fundraiser link to Singh, and he can share it with you guys, and we just encourage you guys to share it with your social media networks.
Yeah, we can also post it on the Outback Strong website.
And I think the last thing I'd like to say is that just generally, we're really looking to try to partner more closely with the community advisory councils and be looking at ways where we could be collaborating and working together more closely, like joint fundraising. I know that at one point we were looking at working together around a mental health first aid proposal, and I think that's a great example of how we could potentially be working together. So if there are opportunities like that, please reach out to us, and we're also working hard with our board and staff to try to figure out how we can partner and work more closely with you guys to to help raise funding to do this work, because we're all doing the same thing.
So John, you, Alana, and a rare person, that's the totality of staffing for all of that good work. Very good.
Nice picture.
You like it? I like it too.
Immediately.
For those
That's my kids, yeah. Thanks, guys.
Thank you, John.
Yep.
Any other
Thank you.
questions of John?
I had a question related to dental labs, but I think Alana would know that. I want to know how many dental labs you had conducted over the year.
The question.
Sorry, I missed that. Thank you.
Yep.
Good. All right. Our vendors, you want to talk about some chip updates?
Yeah, before I start the chip updates, Paul, do you have any updates?
Just the progress report for September. Charlie, you'll be pleased to know that they've added permanently where you were at the same point last year on every county's report. So your influence went well beyond Lakeview.
I think that's a valuable thing.
So this is where we're at. You guys know how the numbers work. The second column is that new one that you haven't seen before, but that's where you were at the same time last year. And so adolescent well care visits, this is, again, goes through September 30. So anything that happened in the schools after that is going to cut down on the 51 more adolescent well visits that are needed. Childhood immunizations, 2 more need to be fully immunized when they turn 2 years old. Colorectal cancer screening, the clinic, I think you guys were, the kits have gone out
Kids
like
went out
last month.
today.
Oh, today,
I just
okay.
got the email, kits were mailed out today, and I think right in the neighborhood of 80, 83, something like that.
Okay, so we need 33 more to meet that measure. Dental sealants, 32. I don't know if you guys have been in the schools, Mindy, or?
Oh, no, that's
She's not here.
included.
Sorry, come forward.
Oh, I'm sorry.
And yeah, they have.
They
Yeah.
have.
I think they've been out twice.
Yeah, I have some numbers, so they did around 60, between 60 to 80 screenings and sealants at North Lake. And
Screenings and sealants?
yeah,
Wow.
and they did a lot at North Lake, and they have done some at Lakeview, and they're also gonna be there next week during the Teen Health Fair, and they're gonna do at least 12 more sealants. So I think we definitely have crossed the target.
Okay.
What's the age for sealants?
It's like 7 and 13 or something like that. When you get permanent teeth.
How's long?
19 more developmental screens. Those are the screens that are done for children between 0 and 36 months. They must be attested by a clinician. A lot of them get conducted in the community by early learning people, but if they don't make it to have that reviewed result with a clinician and a parent, then it doesn't count. Effective contraceptive use, 8. And from what I understand, Susan, I think they've already gotten the people who have had hysterectomy or tubal, or for some other reason are
Okay,
unable, they're already in the numerator.
okay.
The people have moved it. Last year, at the end of the year, we went chasing
Oh,
after
you
clinics
moved
to
them.
go back, and I
Yeah.
think the Oregon Health Authority has moved those people permanently into the denominator. And then the 3 measures for emergency use or the 2 measures for emergency department use and alcohol and drug use, you've met the expert screening already. So hopefully we don't have big uptake in emergency department use during the last couple months.
So if I'm reading this correctly, Paul, on the top line, adolescent welfare visits, at this time a year ago, we were at 17.7%. This year, as of this report, we're at 20.8.
Yep,
Is that correct? And our
Yep.
target is 46,
yes.
40.6. Okay. Everybody see how that works?
You said that for dental, it's age 7 to 13,
I'd have to look up
but
the,
if they're over 13 and they have seals, because we're gonna have all those kids at the teen health fair, that still counts towards it? Because we're gonna have high schoolers.
I think it
But it
will.
starts at 12, age 12 is where we target the teen health fair, so
Yeah.
some of them will count.
I didn't bring
if they're-
it, my data dictionary. I did send it to Sing to get out to everybody, but that's where in each of the measures is clearly defined and what codes have to be built and things like that, so I'm
It may
sorry.
not go toward the measure, but it's still the right thing to do.
It's good
Oh,
oral
yeah.
health, yes.
Yeah, I'm just curious.
Especially when you see what our teen, or what our cavity rate is for kids. That's horrible in Eastern Oregon.
Well, we're hoping it goes down if that SMILE survey comes out. It'd be nice to see that.
They gave a sneak peek at the Oral Health Coalition Conference a couple of weeks ago, so it's coming out soon.
Okay. Which kind of, Charlie, leads me into, we are beginning the community health assessment process again. We have begun to collect the data. We conducted focus groups. Those have been coded. They're being written. So there'll be 2 that were reflected for Lake County, 1 north, 1 south. And the data is going to start to flow. We may need a little bit more time. I mean, there's a lot of stuff to cover in terms of sharing that information back with you. So I think we might need to have 2-hour meetings for the next 2 meetings.
Okay.
I mean, we'll try to go through, but I don't know if we'll be able to get.
And we'll need to make sure that we get information for both Kathy and Shelley to see from North Lake.
Right. We'll get them, I'll make sure that they get that.
Okay. Because I don't know,
We'll
are
send
you
the data.
gals getting all the information? You're not able to see the presentation, but you are getting the information that we're sending you, right?
I haven't received any of this information yet.
Yeah, I'll
Well,
follow
either
the-
pass
Neither
it.
have I.
We haven't sent it yet, it's coming. I'm just giving people a heads up that, you know, we have to do that. And John, just since you're here, I don't anticipate big changes in the priority areas overall. I think it'll still fit for, you know, the activities for the Eastern Oregon Healthy Living Alliance. But we do know, as part of CCO 2.0, that the state is going to require that our regional plan have at least 2 areas that match with the state health plan. And the state health plan areas are tobacco use, slowing the rate of obesity, we're right there, oral health, harms associated with alcohol and substance abuse, deaths from suicide specifically, immunization rates, and protect the population from communicable diseases. So I think, you know, oral and obesity are throughout the region. I don't think we'll have any problem complying with their requirement that we linked up with that. That would be it, Mr. Charlie.
I think you, have you sent this electronically, this?
Yes.
Okay, because
Well, I
that may
sent
be
it
that-
to Singh, and he made copies and brought it to the meeting. So I
Okay,
don't
so
know
our
if
vendor,
it's-
can you send it out to all the members?
Yeah, I'll do that.
Because I think Kathy and Shelley have not seen this yet,
Yeah,
and so it's not easy for them to see. And that'll help you get an idea of where we need to do as our targets for Lake County, and the impact that our membership in North Lake certainly impacts these numbers. So
Right, thank you, we would appreciate that.
we'll get that out to you later on this afternoon then.
Okay, thank you.
You bet, you bet. Thanks, Paul.
You bet.
Appreciate that information. Anyone have any other questions of Paul while we have him on the hot seat? Great. Arvinder, then let's move forward on to our CHIP updates.
CHIP updates. So we have the Teen Health Fair next week on Wednesday. The stations that have been confirmed as of yet are nutrition station. We'll have a public health, wellness center, OSC extension, physical activity. We'll have a dental health station. We'll have the clinic stations. We'll have the crisis center and Lakeview Rocks. And we'll have a food refreshment table and a photo booth. And the public health and the wellness center stations, we're gonna have them in separate rooms because the students need privacy for the depression screening or getting a shot. Last year was amazing. Our public health station was on the stage. Even though we had covered the area where the students were getting their shots, but yeah, I think it was kind of inappropriate, but yeah, we're improving. And so the usual, I think I mentioned the last few meetings also, the process is the students will be given a passcode and they have to visit all the stations. If they get the stamps from all the stations, their name will enter into a bigger drawing. The prizes that we have decided on are, they can win bikes, they can win a fancy Fitbit watch, and we'll also be giving out either ski or swim family passes. So those are the big prizes, and also we'll be handing out a lot of free items during the fair. And also for the students who do show up for their adolescent well-care visit appointment, they also get a sweatshirt. So that's for the Teen Health Fair. Other thing I'm working on is, so I'm working closely with the prevention department and our clinics. We are trying to launch our living well classes, which are quite popular in Lakeview. We're trying to launch them in Paisley. Right now we're working on starting the chronic conditions classes in Paisley. A couple of weeks back we tried launching our diabetes workshop class, but we did not get the minimum required attendance. Hopefully the chronic conditions one, we get a bigger turnout. CHIP's focus for the senior health, again, I think I mentioned this earlier, I'm in the last leg of the Gatekeepers program. I'm sending out the second round of surveys, which will let us know how effective the Gatekeepers program has been in Lake County. On the days when we have CHIP meetings, earlier in the day we have the older adult collaborative meetings. So we discussed in today's meeting, so we had conducted a senior health fair this year for the first time during the Daily Days health fair, which was a kind of a success. We got good feedback. Lots of seniors said that even though we have been advertising the projects and resources for senior health and seniors, many of them found out about it during the senior health fair. So our plan was to do a bigger, better senior health fair next week around June, and we'll also have agencies from Klamath who will be joining us. They're very excited about that. Also, a small thing, so Mr. Rod Howard is also there for these meetings. He's the older adult behavior specialist. So just to inform you guys, he's conducting dementia care trainings in Lakeview right now. Today at 2 p.m. was the first training. It's a 3-hour session. The next training is going to be tomorrow at 8 a.m. It's being held at the Streamy Conference Room at the hospital. And he's going to return in December, and he's going to do the trainings again. And that's going to be on December 13th and 14th. So just so you guys know.
Just for clarification, Charlie, I'm sorry, he was talking about the dementia training. Did you get an answer to your question about that? We couldn't find somebody who could answer.
We don't have a clear answer yet.
Okay.
It's required. The question is, does the trainer have to be certified by the state? Or does the program have to be certified by the state to meet the minimum requirement for long-term care and assisted living? Every person that works as of January 1 in those facilities has to have had that training. There was some discussion whether it is the trainer. Others said it had to be the program, not the trainer. And we don't have an answer yet.
Okay. If you find out, let me know.
As soon as I will.
Spread it around.
Because that is
a little nuance, that's all.
Wouldn't Rod have the answer for this?
what he had so far was,
Okay.
the program is certified, he's not. And what we don't know is does that meet the requirement that the state has?
Okay.
We didn't have a clear answer.
Next update is we have a food co site visit next week. And so the food co representatives are going to be touring the health district and the schools. They want to get to know the school cafeteria staff and the teachers and just have a look at all the amazing work that Brooke has been doing with the schools.
Brooke will give us an update when everyone talks about their programs, right?
And a small update I wanted to give was the CHIP department will be working on conducting dental labs, something that EOLA has been doing for a while.
Dental labs?
Yeah, dental lab sessions. So what that is we go to schools or Head Start and just give them information, education, awareness about dental health with the use of a presentation and models. And yeah, and that's also kind of required with our ODE grant. So I think, so my plan is to do at least one session in Lakeview and one in North Lake before February.
And that's not an Advantage Dental.
I am thinking of, so I've had talks with them. So
jointly do it?
Yeah, so my plan is we have an Advantage Dental hygienist in Lakeview. And so the plan was me and the hygienist would collaborate and give out the dental lab sessions.
So Alana and volunteers.
So that's how they're doing.
Yeah.
Alana's not using Advantage Dental or ODS or some other organization.
Yeah, so in
And
the
by the
last,
way, Advantage is changing their name. They've been
Smile
bought,
first or
and
something.
it'll be Advantage DentaQuest, and then next year it'll just be DentaQuest, I believe.
Okay, good to know.
Well, I mean, they finally got recognized. I mean, I heard people saying, you know, oh, the Apple people, the kids are saying the Apple people are coming and they're gonna change that logo. We'll see what happens, yep.
Branding is difficult.
It is.
and before I conclude my updates, I wanted to start a discussion with the council. So the CHIP and LCAC, the scope is pretty vast, as we all know. We have members from all the areas of the community who show up at the meetings, and also our discussions are very vast. So I was wondering, for example, we have clinic-related discussions like the incentive measure report, and we also have physical activity with OSU, iTry, or the food court. So I was wondering if we wanted to start a discussion. So we have 1.5 hours for the CHIP meeting usually. So because many times there are members who are not involved with, for example, many people are not that much involved with the incentive measure report discussion because that isn't, that's not a part of their work, and it goes either way. So do we want to do the first 45 minutes, we have clinic discussions, and the rest 45 minutes we can have other community-based program discussions and people, and then can we do that? Paul, do you think?
Oh, you can do whatever you want.
Okay.
I
We
mean,
should put the community discussions first.
Community discussions first?
Yeah, that
Okay.
way, once that's over, then the parties that it's not pertinent to, would be excused.
Yeah, so the discussion is just very relevant for whoever's.
But there are some of these incentive measures that are.
That do involve-
That do involve the broader community, especially stuff that, like norming. I mean, trying to change the norms of the people in the county that it's a good thing to go to see your doctor when you're 13, even if you're not sick,
Yeah.
right? I mean, that's it. The colon screening, I mean, John's group figured out that a lot of it comes from other people telling you that it's okay to do, not from, you know, so that's a community norming kind of thing as well.
And the 2.0 requires that community involvement, right?
It does. And it comes through the LCAT.
I like the idea of having the community folks coming at the beginning, and then I think you just, you know, you don't exclude them from the clinic portion.
Right.
You invite them to participate in, but my guess is majority of folks it's too technical, and you know they're just, the interest level isn't there.
Part of what we're learning though, as we do the different grant meetings and whatnot, we're learning that we're really siloed in the work that we're doing, and a lot of times we're reinventing the wheel in all these different groups. And if we were all on the same page and collaborating, we could all move that goal faster and with less rework. So I would encourage the community members to stay.
I appreciate that. I just would want to also remind the community members that if we don't meet these measures, the money that you get is all tied to this.
Yeah.
So it has some importance too, in terms of funding. But yeah, we can make that happen.
Yeah, and we can have more discussions.
I think it's a great idea. Anybody else have thoughts on this?
I'm thinking it might encourage more attendance if we're talking more programs that everybody can relate to at the beginning of meetings. That makes more sense. It's visual, you can understand because you see those things happening in the community.
Yeah.
So, I don't know.
Okay, we'll set the agenda to accomplish that
Yeah,
for the next meeting.
and that concludes my updates.
Good.
Brooke, do you have some food updates? Sorry, I forgot.
Oh, yeah. Well, last month we had our farm to school stuff, so we did weekly taste tests that went really well. I'm going to switch to doing them once a month instead of every week or every other week to be determined. But that's going really well, and the cafeteria staff are interested in starting to implement some things onto the menu. The schools, this month is school breakfast month, so switching my focus over to breakfast. And actually yesterday we had record numbers of breakfast attendance. Over 100 kids went to school breakfast at 88 Fremont. Could have been because it was churros though, so not sure. Yeah.
That's really healthy.
Yeah, so speaking of that, next Friday I'm going to do a taste test at the school breakfast. And we're going to start looking at, instead of just focusing on lunches, which is what I have been doing, starting to think about school breakfasts, because a lot of kids do rely on those. The other thing I've been working with the cafeterias is that they have procurement money from Oregon Department of Education to spend towards Oregon grown and processed foods. So we sat down and went over some of the things that they want. One of the big ones is that they want to be able to switch from using really cheap margarine that they use in a lot of their baked goods to higher quality butter, just because it's something that they're constantly using. So that was not where my head was at all. It was like fruits and vegetables. But it makes sense because it's something that they're using a lot. So we're looking into Tillamook butter for the school, which would be fun. There's another company called Stallbush Farms. They used to sell it in Safeway, but they stopped, and I'm going to go bug them about it. But it's an Oregon company it's all frozen fruits, frozen vegetables, and frozen legumes. And so we're hoping to get that into the school to use those ingredients. And the third one was Bob's Red Mill. So for school breakfast, they have some oatmeal cups and like different types of cereals and stuff. So we're hoping to use the money towards that and look more into that this month.
Excellent.
Small update.
Brooke, I have a question for you. Are you seeing, or are we tracking if the kids that have gone through ADA or the elementary school programs, are they continuing to choose better foods as they get into junior high?
I think that would be something really interesting to look at. We've only had food court, this is our third year. So, and I'm mostly in the younger elementary school than the upper elementary school. The 5th and 6th grade teachers don't use it as much. But I think that would be something really interesting to maybe like put that into just letting the high school cafeterias know that to see if they see a change in the next few years. That would be interesting.
Well, you mentioned Bob's Red Mill. The Moore family gave Oregon Health Sciences University and Oregon State University, I think it was $500 million to do some work. And what you're describing is a plate waste study where you actually measure what people are eating. You observe it and you measure, you grab the tray off of the student when they're done. We've done some of those up in Jefferson County when I was with the university. There might be some resources there.
To do a comparison.
Well, what a researcher at OHSU or OSU would want community partners to help them organize how it would work in the school. You need that, and it's called community-based participatory research, and it's your data that tells you what you really kind of want to do. So
That's something, because what I'm
there
really
may be
thinking
other
is,
things that you'd rather do in food court, but I mean, there's money there. But, you can't do, community research if you live in, the Ivory Tower. You have to have partnerships in the community.
sure. Well, certainly, if we're making a difference by teaching people something, and if they enjoy it for a little while because it's fun and novel, but it doesn't change their behavior, how do we change our activities to make sure we change behavior?
So I've noticed I have kiddos that Brooke interacts with, both at the older level and the younger level, and Ellie constantly comes home, Miss Brooks coming, we're doing a taste comparison today. Last time we did butternut squash. And she will, like, Mom, this isn't a very healthy choice. Why aren't we having a different vegetable? And she's trying new things because of this program. So, I mean, I can't say that that's making a change in every child's life, but I have to read that it is. I mean, they are making better, healthier choices and lecturing me about it.
Being very judgmental
They
about
are.
what other people are eating.
Some parts are good and some are excellent.
Sorry.
You can do it.
Okay, well, one other thing I was going to add that I forgot to mention, we talked at the EOCCO meeting about the backpack program. And Susan Warner, so they're not gonna do it through like stuff with EOCCO, but the school is interested in looking into a backpack program, which is on Fridays. So I didn't realize this, but she just told me this, is that they have a few teachers who go to Safeway and they know which kids need food on the weekends. And those teachers spend out of pocket and get food to send home with those kids on the weekend. So we're gonna look into grants. I'm just gonna partner with the school and do that to try
Is
to get
that
them.
partnering with the school or is that partnering with the teachers?
Well, it would be a grant for the school. So, and then we also, just these conversations, things get brought up, and the cafeteria staff mentioned that at the end of the day, they're always throwing out sandwiches that they made that could be sent home with those students. So a lot of this conversation just starting is making a big change.
Awesome.
Yeah.
Well, I mean, I think in school food systems, waste is about 57%.
Oh, is that right?
Oh, yeah. And nationally, we throw away half the food that we, and a lot of
Food
it's
distribution problem.
well, it's institutions too,
And it's a
right?
portion problem.
Yeah.
Yeah. And North Lake has backpack program. It's supported through one of the churches.
Okay.
And then the school buys the backpacks each year, and then the church does buys the food and keeps the pantry and organizes that,
I
so.
was thinking
They do
there's so
other
many.
things in theirs though too, like when the school year
Hygiene
first,
products.
yeah, they do hygiene products and things when the school year launches.
For that, yeah.
I was thinking since we have all those extra, unless we've used them, those Outback Strong, the yellow ones from last year, those backpacks, I don't know if we could.
So we're gonna use some next week,
Okay.
and after the health fair, let's see how many we have left over, we can use that.
And I don't know how many kids it is that it would be for
Yeah.
anyways.
Excellent. Thank you very much.
Yeah.
One follow-up, what does a site visit entail next week? Are you in trouble? Do you need help?
Right. No, so there's 10 of us throughout Oregon, so they come around they're gonna be shadowing me, watching me teach a lesson, and then also just getting to know the community and the
Oh,
site.
okay.
Yeah. So if anyone has any interest in meeting up with them, they're all about it.
They also have a new food court recruit, so they also wanted to show her around the southern Oregon area. I think their plan is that the new recruit will at least make 2 to 4 visits every year to all the food court sites.
Good. Thank you. Christie, would you like
Grants.
to talk about grants?
All right, let's start with the fun page first, with the hand. So we have gotten a couple of new grants in the last couple of months. One was through Oregon Health Authority. It was a reproductive health mini grant for $10,000. I worked with Judy Clark on that. We're going to use the money to buy a computer for the reproductive health exam room at Public Health. They don't have one back there right now, so everything is happening, charting is happening by hand. We're going to buy a couple of tablets too, so the goal is to get rid of the paper system altogether for that program, which will be nice. They really wanted to see efforts to improve patient experience too, and so because a lot of the patients are teenagers, young adults, that's who we're seeing coming in for reproductive health, making sure that it's a welcoming environment, so the money is going to buy a couple of bulletin boards where Judy can put up information about STDs and reproductive health and whatnot. And then the little pictures there, Judy and I had a really good time shopping for potential swag items, and they'll just be stuff to have on hand for them to hand out to the people who come in to have some kind of exam, just to have a positive touch point. We'll put the public health logo on the stuff, so the little hand is a highlighter, and then the little finger puppet is your little phone cleaner. And she found notebooks, and we're trying to get different swag than what we've already given out for the health fair, just to spread the love a little bit. The other grant, the health district received a patient safety grant through Coveris for $10,000. It's gonna buy 4 AEDs for the facility. One will go in rehab, and one is going to go in the clinic. One will be in the hallway leading to the clinics. and I can't off the top of my head remember where number 4 is going, but 4 AEDs.
Central reception area.
Oh, no, the West Wing, West Wing.
Yeah, one there, one in the middle, over there.
Don't remember that. Anyway.
Does everybody know what an AED is?
If you were to have a heart attack, we could fit the AED and shock you back.
Automated external defibrillator.
Ah, okay.
It's like a fancy taser.
Yeah, literally shocked me, huh? Okay.
And you want it if you need it.
Yes, you do. Part of the grant too is gonna making sure we're increasing the number of health district staff who are certified in CPR. We're at about 60-something% right now of our staff are current on certification. And I think, if I remember right, we're trying to get to 80%. So that's a wonderful deal. And our thinking was, and our justification in the grant is not only does it make our facility safer, but we have that many more people trained in the community to deliver CPR. So. And then we'll switch. So this sheet, we've been awarded a grant through PERSA, the Rural Communities Opioid Response Program Planning Grant, which is a mouthful. It's the RCORP grant. And this is to help us partner with different agencies in Lake County, Klamath County, and Modoc County. The gist is that we want to really get a handle on what resources we currently have to address opioid use disorder and substance use disorder, figure out what the holes are, and then as a tri-county region, come up with a plan for workforce development, because that's one of our major issues is we don't have the manpower to deal with all of the substance use disorder that we experience here. What's the other plan? Not sustainability. Let me see another plan. We have to come up with another plan.
Another plan.
Workforce.
Well, the first was the training, then the workforce, and it was the collaboration between all three counties.
Anyway, there's another plan somewhere in there that we have to come up with.
It's always sustainability. That's always the.
Yeah, that's the last one. We'll get to the sustainability at the end. As part of the grant too, we wrote in that we want to make sure that all of the officers, law enforcement officers in Lake County are equipped with Narcan. Narcan is what you can administer to someone who has overdosed on an opioid. It will temporarily reverse the overdose. Right now in North Lake County, our deputies have it, or in the state police have it, but here at the south end of the county, they do not carry Narcan. So we're going to make sure that everybody has that. The hope with this is that we have this planning grant, and this is a foot in the door for implementation dollars. So once we really get a handle on what we need, then we're going to go after additional grant dollars to really address those issues. So stuff that's pending, we are still waiting on the grant for Outback Strong Fresh. We have not heard yay or nay from Oregon Community Foundation yet. Last month, I was not at this meeting because I was trying to meet the how-to grant deadline, the Healthy Oregon Workforce Training Opportunity. We asked for $1 million to support our student nursing program, our partnership with Klamath Community College and OHSU, and also our new nurse residency program, which is taking these new RNs who've gone through, I think this year they're mostly ACC grads. Statistics show that if you're going to quit nursing, it's that first year that it's probably going to happen. It's just a huge transition to go from being a student and learning about nursing to, oh my gosh, I have someone's life in my hands. So this residency program is a way to really ease them into it. They still have some classroom training. They're learning all of the different departments that are in the hospital. So we're really emphasizing that teamwork, collaboration piece, because we are so small and it's just good practice to work as a team. So we should find out in mid-December. I just got an email about this yesterday, so I think it's December 14th that they hope to let us know, and the money would be available as early as January 1st. It's not it's a long shot. The email I read yesterday, I hadn't known this going in. They may not award any grants, so we'll just see what happens. The other one we're waiting on, Jill, Harlan, and I just applied for this OHA Oregon OX grant. And in a nutshell, it's gonna buy some portable coolers that they can carry vaccines in, pay for some signs for public health, pay for some advertising, and we're gonna do an immunization clinic in Paisley, probably at the school, to catch the kids prior to school exclusion day. The Paisley kiddos are gonna be at the teen health fair next week, and a lot of them will get immunizations there. But this is gonna catch anybody who's left. Paisley's kind of an interesting anomaly in Lake County when it comes to immunizations. Our rates are really good in general as a county for kids getting all of their required vaccines. I think Lakeview last year, in large part because of the teen health fair, none of the kids, had 100% attendance. They had nobody missed for school exclusion day. Paisley, the rate last year was 57% meeting all of the immunizations, but Paisley, only a third of Paisley students are actually going to school in Paisley. They have the online program, and so they've got 140 students this year who do not live in Lake County, but whose lack of immunization is counting against Paisley School in Lake County. So we're gonna do what we can to handle our kids, our Lake County kiddos, but there's nothing we can do about the kids who are enrolled in a Lake County school but don't live here.
How is that, really?
Because they're online,
They're online.
They're online, there's,
You
yeah.
can't,
but they're still enrolled in the
It's that
school.
policy.
Yeah.
that is a bad policy.
Yeah.
That
Where
should
do
be
they
on,
live?
it should be on their residence.
All over the place, all over the state.
All over.
It's a charter school, so they can live anywhere.
Yeah.
Why wouldn't those rates be on, based on their, where
Their
they
county of
live?
residence.
Because it's the school.
Yeah, it's coming through Oregon Department of Ed that's counting this and by their school district. And none of the exemptions last year were medical, which isn't really surprising, so. Anyway, that's a good one. What is in progress right now, we have met a couple of times to talk about the LCAC dollars next year. We've landed on a 60-40 split, so 60% of our dollars are gonna go toward addressing social determinants of health. We have a couple of different projects that we would like to support. So at the north end of the county, one of the major issues is access to fruits and vegetables. They have a couple of produce stands there, but you can go to the Chevron and buy a $12 head of cauliflower. They do not have a lot of options for produce there. The clinic, they offer a voucher program that's good at 3 different grocery stores in the Pine and at those 2 produce stands in Christmas Valley. The vouchers are going right now to patients, obese patients and patients with diabetes. Those are the 2. So Kathy Pike has been looking into bringing Veggie RX to Christmas Valley so that we can have that, that is an option for patients. So Kathy and Shelley and Arvinder and Brooke and I are gonna try to talk a little bit more, and I'm gonna ask you right now if you know, Paul, criteria that we have to meet. Is there a certain patient that we must be using other than just being EOCCO? Who can we give the vouchers to? Prescribing vouchers.
Just to be clear,
Yeah,
we're operating the Frontier Veggie RX program.
okay,
There are probably 24, maybe statewide, different types of voucher programs for fruits and vegetables. So our program right now is Gillum, Sherman, and Harney counties.
okay,
Harney restricts theirs to EOCCO patients,
okay,
mainly because the money would be gone instantly.
right,
Gillum and Sherman are able to serve the entire community.
okay,
And, you know, the vouchers, there's enough money there to pretty much get them through 11 months with the people that screen positive. If you're interested, we're having another meeting on the 16th with OHSU people who are concerned about how we're saying we are targeting hypertension and diabetes. We do collect, if it is an EOCCO member who's getting the vouchers, we do have the Medicaid number and are able to look and see if there's changes in spending for overall health claims or improvements in hypertension or diabetes. We're also thinking, you know, and I think I mentioned it down here, like, you know, just to really target and a smaller level, but that population health opt-in grant, where you're looking at the hypertensive and diabetes, just do the Veggie RX program, or Frontier Veggie RX program within that.
You said they ran out of money really fast when they left it wide open, right?
Oh, no, we knew that we would run out of money real fast in Harney so we restricted right from the get-go. And we're just getting the data back. I mean, the program there, Christy, you really want to just kind of work with us and include that portion into the overall application. Marcy McMurphy is a GOBI staffer, and we covered the administration of it. So
Okay.
most of the money, 95 or 6% of the money goes to vouchers in the communities.
Okay,
The other little bit is some travel and attendance at the statewide meeting where all the veggie programs get together and share their news.
and you mentioned the population health management grant, would it be better?
The opt-in.
For that, you're thinking that is a better way to go for funding
Well, I
for
think
that?
if you had $30,000, you could target EOCCO plan members with hypertension and diabetes and really, they
That
could
make
get
an
it now.
impact.
Well, that
Yeah.
might be, maybe that's a conversation I can have with Alan, that might be something that they
Maybe
can
we wanna
go
take
after
that out of
specific. Yeah,
LCAP and move it to Often.
yeah.
Well, yeah, it depends. You really need to look, and I can
Yeah.
provide you some guesstimates of how
That'd be
many
good.
people, but you do need a prescriber.
Right.
Somebody does need to screen people.
Right,
And, but the system's set up. We have training for the vendors, if the stores wanted to, it's all, we're ready to roll.
cool.
So.
Kathy, are
we
you
can-
hearing all that?
I am. Our main focus here would be the children. It definitely warrants more conversation.
Yeah, Kathy, you can
It's
pick,
really hard to understand and hear through the phone, but I would love to have a conversation about it.
I'll connect with you, Kathy, as well as with Christy, just so you know the resources, and this is Paul. You can target populations with it. We don't have any issues with that. Some of the other programs, we make our own rules.
Love it.
So this is Shelley. Yeah, this is Shelley. With our existing Veggie RX program, we do target the diabetic patients and the hypertension patients, and so we're not looking for more money for those patients. We're concerned about the children and the nutritional disparities that they have in Christmas Valley.
Okay,
So
so that program that you're using for the vouchers is through the Central Oregon Health Council, correct?
I'm not sure. We just applied for some more grant money for more fruits and vegetables. But I do know that the Central Oregon Health Council is a big supporter of our program.
Okay,
So
yeah.
I'm not exactly sure on the funding, but we do have funding right now for those specific patients that you're speaking about. So we were just kind of expanding and trying to focus on children.
All right. I'll follow up back with you, Kathy, and I'll copy Christy on that.
Awesome, thank you.
So that was the north end side of that social determinants dollars from LCAC. On the south end, we were looking at physical activity, and one thing that came up in our discussions was wanting to have more opportunities for families, kind of what you guys want to do, John, with the Hike It Baby program, but more opportunities for families to be active together. Seroptimus Park came up. They're getting a lot more traffic there thanks to the disc golf course that's gone in. They're seeing some more people. Anybody who's been down there, you guys know that the fitness equipment is, I'm going to use the word scary. It's splintery, it's just old and could use some updating. Jamie Davis with OSU Extension did a little bit of research, just looking at some different companies that provide play structures, looking for something that kids can climb on and be active. And younger kids aren't going to do the disc golf, but something for kids to do if mom and dad want to come and walk or fall, which apparently is something that only Montana people say, disc golf, whatever. So the picture there is just one of the many cool options of play structures. this company that Jamie found, she did some research and this was the best company with the most options. So this is just an idea of something that we might be able to purchase to encourage that increased physical activity.
It's a plastic system or it's a metal system? with plastic
I
coating?
don't know, actually.
Looks pretty cool.
Yeah, it does look cool. I want to play on it, so.
Chris,
Yeah.
did you run that by St. Curtin and Ann King?
Not yet.
I would do that.
Okay.
I mean, I think you need to emphasize, just 60% we can do what we want with, right? I mean, emphasize that, because I still see them trying to manipulate things a little bit.
Okay.
And so you mean they would not see this as a benefit to meet the
Yeah,
interest of the CCO?
Okay. In our heads, it's aimed at that weight assessment,
Right.
counseling for physical activity
Yeah.
and nutrition, so.
Exercise and weight loss.
right.
Yeah.
No, I think it's great. I mean, you know, that they had a community garden built in Harney, and people were like, oh my God, what are we doing? You know, and so, this is good. Teach your kids how to grow food, and
Yeah,
process it, and
yeah,
eat it, and it's like, well,
yeah.
I just worried a little bit on that one. So
All right.
I would just give them a heads up.
Will do.
They may just say, no, you can do what you want, but
Okay.
see what's up. Did you participate in any of the webinars?
I was sick on both of the webinars, but I have the follow-up information and touch base a little bit with
Okay.
Susan about it, so.
All right. So, because I don't see any opt-ins. Oh,
So.
Sorry.
Overachiever, she has a page and a half.
Yeah, back page.
Sorry.
So the opt-ins, we're meeting on Monday, if anybody's interested. We're gonna meet at 10 a.m. Monday in this room to figure out which opt-in grants we want to go after. Adolescent welfare visits are on there again, colorectal cancer screening is on there again, the population health management, like Paul mentioned, is there. ED utilization, that one's on there again, so we do have. Yeah.
And Kathy and Shelley, that includes you, because we are not, this is not Southern Lake County
Right.
focused. It is the entire county, so we want to make sure that you are thinking about how we can use money in North Lake.
Right. I'll say too, for North Lake, I mean, there's no reason if there's something that's specific. I'm happy to write county-wide programs, but I mean, this year we have one of the population health management grant is just Lake Health Clinic. And that was in part because of the system that they're using, Athena, is that the right system, do I have that right?
Arcadia.
Arcadia,
Oh.
it was an A.
Yeah.
And we were the only ones using it, so it doesn't necessarily have to be an LCAC-driven thing, if that makes sense. I mean, yay if it is, but especially with things like the adolescent welfare visits, that makes sense. The other quick one, sorry, I know I've talked a while. Arvinder and I are gonna get together later this month, and we are gonna apply to host another AmeriCorps Vista. We have one right now working with the clinic, helping with some opioid-related things. This person we are envisioning is someone who could maybe help with the nutrition and hunger issues countywide. Emmy Harcourt was here before I got here, but she completed a food assessment, countywide food assessment, looking at food deserts, our access to food, community gardens. It was anything you could want to know about food in Lake County, it is in this report. We haven't done anything with it. So we're hoping that Vista can actually take it and move forward with some of the recommendations that were made in that report. So that's what's happening this month.
I think I remember that. That was a few years ago, though, right?
Yeah.
Yeah.
It's a
Okay.
really good report. If
Yeah.
anybody wants the link, I
You were here
can
for
send
a
it out.
presentation.
Yeah, it's been a long time.
Yeah.
Okay.
Yeah. And it was, I think 2016 was the date on it, but I went through it a few months ago and not much has changed since then. We've lost a couple of stores since then, so,
Yeah.
Yeah.
yeah. That's what I know.
Thank you. In our last 10 minutes of our meeting, I'd like to ask that all of you give us some suggestions as we're thinking about, Paul talked a little bit about CCO 2.0. That means that there's going to be some changes to how the CCO program works. And one of the things that we're going to want to think about is how in Lake County can we impact what we call social determinants of health. And those are those factors that go into what causes people to have trouble with their health. And Gloria, as I look at you and I think, okay, people that you deal with that have come to the crisis center, they have a crisis going on. And so if a healthcare event is that person that's in crisis of some kind, it's probably some form of personal social crisis. If in the meantime they're also having some heart trouble or having some high blood pressure trouble, it's really hard for them to focus on their heart or their high blood pressure when they're dealing with other crises. And so I think if you could help advise, give us, and we talk a little bit about what are some of the things that we could do in Lake County as we're thinking about ways to improve those items within the communities that we serve. And you serve different components of our total community. That we could do something to make a difference so that it would help those individuals that have a crisis of one kind or another that impacts their health. Or the opposite way. People that may be coming to use your services had a health crisis that led to another, and all of a sudden they've got a whole life crisis going on. So it happens both ways. Any thoughts about what we should be thinking about?
There's something I was just reading recently about, and it goes back to the ACEs, you know, your ACEs score.
Adverse childhood
Thank you, yes.
experiences.
And it was a recent study on that and the connection between health and ACEs, and so that in every way, what's happening in your early childhood affects, you know, your heart disease, your obesity rate, all these other things that come down the road later. And so I really think that we need to really focus on parenting and early childhood funding across the county, you know, not just down here. I understand from the work group that we have in North Lake, and if anybody in North Lake hears something that I say that's wrong, feel free to speak up. But that they're looking at healthy families as looking at trying to find a way to get back up there and do something to help with parenting and to help encourage young families. But you know, we've had Head Start, you know, had to leave, and there's just this long, there's this long history of lack of services that would help that, and you've got a population that is very light apart, but they still need that because every kid counts. And it's frustrating to me to have parenting get one of those cans that gets kicked down the road, because meanwhile kids are getting hurt emotionally and physically in every way.
Mm-hmm.
And I'd like to see us look at that simply because it really is upstreaming.
Okay,
It-
excellent.
Data-
Other thoughts?
Sorry to go along with that too, just the US Census Bureau data from 2016, which is the latest that we really have information. It's almost half, not quite half, but almost half of the kids 5 and younger in our county are living below the federal poverty line. So that is a really good age group to target.
Okay, excellent. Other thoughts?
Well, I have a thought, you know, with the clients that I've worked with, you know, as far as the stress level that they have in their lives due to, you know, abuse. It's probably would be a good thing to have, you know, victims of abuse, you know, sexual, domestic, as part of a screening process. And I think that is being done by the medical clinics here, but I don't know if that's something that could be incorporated into what you look at because of the anxiety, the trauma that a lot of the clients that I see experience, health issues related to cortisol, and that then triggers other issues. And because of what goes on in their lives, nutrition is a factor. They don't have time to plan meals because they're always worried about, how the abuser is going to react to whatever it is they're doing. So I think it's something that should be probably identified here where you do a screening for it. And
Yeah, I'm in full agreement. Where that probably would be best served though is, collaborations within the community to target specific populations and then get resources to them. High utilizers, they have high physical health needs, high mental health needs
Yes.
in that quadrant. But the incentive measure stuff, we get told what to do from the Oregon Health Authority. We don't get to pick where it is, but I mean.
But that doesn't mean.
No, we can do something here.
Yeah.
As a community.
Yeah.
Right.
Yeah.
Think about and create our own. We have some Oregon Health Plan centric measures, but we can create some of our own.
Yep.
And that's really the kinds of things I'm asking for your suggestions on and thoughts on. These are very, very helpful.
And to go beyond just the meal, Gloria, I mean, the other social determinants, housing, supportive housing is one area, transportation and food, those are the big ones. And then, it's like educational opportunities, but I mean, that's so much money to invest in that. But I mean, when we look at the early childhood, we're bringing in data that we're seeing going like this over 2000, you'll see this. I mean, it's what percentage of your kids in Lake County have third grade reading level? I mean, it's just gone. Either they upped the test or everybody in Eastern Oregon got really bad fast over the last 6 years. I don't know what's going on, but.
You keep talking about innovative programs, so I'm always sending Christy things that I find that I'm like, oh, is this innovative? And send them to her. And she's like, no, I'm not reading it until Monday when I'm at work. But they even have some infant court things that are going on nationwide, where because that child as an infant, and those early years are so important, and they're in a house with domestic abuse and violence, that they need advocates and they need somebody to be able to make sure that that child is going to be safe. And so I thought that was really interesting.
Yeah.
Yeah, 3 years old is key, right?
One of the things I'm seeing, now that this is our second year with the Teen Health Fair, is the social norming. It's my sales pitch is a whole lot easier this year. I noticed to get people to schedule their adolescent well-care visits. It's becoming, hey, it's okay for me to go to the doctor when I'm not sick. And so part of what I was talking to one of the moms about last night was it's not only a great thing to make sure that they're healthy now, but that they're making good choices now, that we're teaching them it's okay to go to the doctor before they're sick, so it's teaching them how to do that as an adult.
Yeah.
So, and getting their immunizations and those things, because it's becoming more socially accepted in our community. I can tell you 3 years ago, my clinic gave 100 flu shots. Last year, my clinic gave 479 flu shots. And through yesterday, we've given 318 this year. So that's just telling me that we are making a change. It's becoming more acceptable for people to do those preventative health things.
Good.
Anyone else have any thoughts? Oh, John, sorry.
So the big three social determinants of health, nutrition, access to healthy foods, transportation, and housing. I think that the low-hanging fruit here would be nutrition and access to healthy foods. It seems like any hard code courts report and recommendations would be a great place and opportunity for strategies to be looking at. And then for transportation, I don't know if this is a stretch or not, but so the integrated nurse home visiting program that we talk about, I think that one of the things that program does is it addresses a transportation barrier that that folks experience, especially with, folks, moms experiencing depression and just the struggle of, not only, I think one of the barriers is stigma, but one of the barriers is just transportation and getting the services that they need. And so what's great about the integrated nurse home visiting program is that we go out to the moms where they live and provide the services in the home. And so it I think indirectly addresses that transportation issue. We're interested in talking with other counties and other organizations about bringing this program to to other counties and other organizations. And so just throwing that out there.
That would be great for us to, because we identify a lot of that during the prenatal visits and helping moms through that in the first part of life after delivery. And so knowing that certain programs like that are available that we can partner with potentially would be great. So we can, a lot of the barriers we have to prenatal and postpartum appointments are that they simply can't get here. So if we had some, other resources that would be awesome.
Well, those are planned visits. I would hope that we were referring them to non-emergency medical transportation.
We are, in fact. There's little cards in all of the exam rooms with that telephone number.
Yeah, so I mean, those are planned.
And I have to say that Andrea's not here from the Senior Center, Andrea Wishart, but I thought that her report today on transportation at the Adult Collaborative was very hopeful compared to the kind of, oh my gosh, crisis kind of that we've had in the past, like last summer. And so some of the things that like Health District has helped, the gardens and the OHP and just a whole bunch of different things have really helped that. I'm not saying the problem's solved, but it certainly, wouldn't you think it was much better after
No,
that?
it's much better this year.
Well, we're going past our time. I really appreciate your thoughts. I want you to keep thinking about it, because this is going to be, I think, certainly in 2019, something we're going to talk more and more about. So if you can be thinking about ways that we can impact, may not be just money, may not just, but ways to impact how people, if we use the term social determinants of care, or social determinants that impact care. So when we say housing, that might be one component. Transportation, I mean, as you think about that, what does that mean and how could we make a difference? These are all really good suggestions. Do we have anything that anybody would like to bring up now before we finish? If not, thank you all very much. Oh,
I have a question about the cancer travel fund.
yes.
And so I have clients who maybe need to access those funds, and I was wondering how they go about getting an application, that sort of thing.
We could talk about that offline.
Okay,
That might be the easiest way so that we can address it.
okay.
Other issues or questions?
There's a Thanksgiving box distribution, if you know anybody that could use some food. It'll be on Tuesday, November 20th, from 10 to 1 and 4 to 6 for the working people.
Excellent.
It'll
And
be
where
down
will
at the
that,
warehouse. And I'll have posters up of this from in different places, so anybody's welcome if they need, especially if they need food.
okay.
But it doesn't matter if you're working or, even if you're driving a Cadillac, you won't be turned away.
One other thing that we're bringing up that kind of thing, the Tree of Joy. Everyone
Yes.
knows about the Tree of Joy.
Yeah.
We haven't had a lot of people sign up. If you don't know about the Tree of Joy, that is a program that has been sponsored many, many, many years. And it is where people on Christmas trees in public buildings, often the banks and other stores, pick a gift, and then gifts are purchased and then distributed to people that need them.
Yeah.
Children that don't have as much as they would like to have, and parents This is a great way of
Pick
supporting.
one of the cars off the tree.
So
Yes.
one of the ways to help know who are those people that really qualify for this is to submit the names to DHS. So if you can do that and pass the word and say, please, if you know someone that needs a little boost, to put their name in so that their children can get
Right,
access to it.
yeah.
It's put on by the Rotary Club and I'm a member of the Rotary. But
Is there
that's,
an amount, a limit, or a maximum amount, Diane? And I had a conversation about how, she would like to buy, some people buy bikes or they buy
Yeah.
very expensive items,
Yeah.
and then if all she can afford
Yeah,
is a $30 item or less,
right.
how does that make the kids?
I think they've changed that. They're trying
I
to.
don't know the answer to that,
Yeah.
but I could get the answer for you.
It'd be nice to be able to put money towards
Socks,
it.
slippers,
Yeah,
clothes, a lot of them are just basic need things now,
Yeah.
but at least on the trees I see in
Yeah.
Central Oregon.
Right.
The cards usually tell you, it's like,
Yeah.
what does that child need, what is all their clothing sizes, and then what is their like one wish.
And they're even
Yeah.
discouraging any electronics
Okay.
to get for the kids, so.
We were talking through the Lions Club too, and they were saying something, there's one out too called the Wish, along with the Tree of Joy.
Excellent. There's a lot of programs, because there's a lot of people that have
And Toys for Tots came in this year as
I
well.
didn't have that one, I got one card.
like to call the meeting to adjourn. Thank you very much for all of you.
When's the next one?